let's move on to our first presentation. We have Andy Tovar, who will be going over our DHCS social media platforms, Instagram specifically, and share how this can be a useful tool to help Medi-Cal members stay informed and up to date. After Andy's presentation, we will have Paula Barberia, who will be going over the birthing care pathway, and then we will pause and take questions before moving on to end our webinar. So Andy, please feel free to introduce yourself before you begin.
Thank you. I'm Andy Tovar. I'm the social media manager here at DHCS. My team runs both the DHCS and Medi-Cal social media channels. And today I wanted to just kind of walk through some of the content that you'll find on our Instagram. So I'm going to share my screen. Okay, this is the Medi-Cal Instagram. I wanted to show briefly, back in March, we did a birthing care pathway campaign. And so I wanted to show you some of the content that we posted around that. So I'm going to scroll a little bit. We felt that it was really important for Medi-Cal members to know the difference between doctors, midwives, and doulas, so they can be educated and and know about all the benefits that are available to them. And then we also have been kind of moving more towards video content. So we did get to interview a Medi-Cal doula, again, to bring more awareness around doulas and that this is a benefit that's available to Medi-Cal members. And so hopefully you've seen this, but if you haven't, I'm going to play one video right now.
People may not know about. What are some benefits of having a doula that people may not know about?
The first one is advocacy. Your doula will guide you through advocating for yourself and hold space for your voice, your preferences for your birth, and your body. It's statistically shown that with a doula, you have less interventions, better outcomes for risks. And if there are things that go off the beaten path a little bit, your doula is a person who can recognize those things earlier because they're with you more. For people of color, having a birth doula is one of the things that's shown to amplify their voices so that they are heard by healthcare providers, but it also helps to have someone who can navigate the healthcare systems. And when something comes up, maybe there's medical terminology that the family may not understand, the doula is able to explain to them what the providers are offering and then hold space for the birthing person to make the decision.
So go check out the rest of our videos. They're really great. And yeah, if you don't already follow us, please go follow us. We are also very open to collaborating. And if that's something that you're interested in, please feel free to email me at social.media@dhcs.gov. And that's it. Thank you so much.
Thank you, Andy, for sharing our DHCS Instagram page that can, again, be useful tools for our coverage ambassadors. We will now move on to our next presentation for today. We have Paula Barberia, who will be sharing or presenting on birthing care pathway. Paula, please feel free to introduce yourself before you begin.
Thank you, Isabel. Hi, everyone. For those of you whom I haven't met, my name is Paula Barberia, and I am DHCS's Chief Quality and Medical Officer and Deputy Director for Quality and Population Health Management. That's a very long title, but the most important thing to know is that my team at DHCS is really responsible for making sure that the quality and equity of care that our members receive is excellent and exactly what they deserve. So I'm excited today to share with you all of the work that we have been doing to improve maternity care for all of our pregnant and postpartum members and their families. We can go to the next slide. So we're going to go over sort of how this project came about, what specifically some of the changes are, and then really do a deep dive on the Medi-Cal member communications that we've created as a part of this project. We can go to the next slide. We can go one more. So as many of you know, Medi-Cal has covered pregnancy care for a long time. It is one of the core parts of our program. And we've realized that there are definitely parts of this work that needed some modernization, needed updating, and that we'd been hearing from our members that their experience during pregnancy and postpartum care was sometimes fragmented and hard to navigate. And so we undertook this overhaul of our maternity policies, which we are calling the birthing care pathway. And we really envision that when we get to the end of this project, that our members will really be able to access and use all the pregnancy-related services that are available to them as they wish, that they will get risk-appropriate care and have choices of the provider type that most best meets their needs, that our members will feel heard and respected throughout that journey, and that we'll really be integrating especially social drivers of health and behavioral health services to provide whole person care. We can go to the next slide. So for those of you who want to do some deep dive reading, our final report, which is about 130 pages, was released in February. It covers the policy as well as the sort of care model and delivery model that we envision for all of our members from pregnancy all the way through that first year postpartum. And it includes whole person care policy solutions, really tackling not just the medical care that they need, but the behavioral and health related social care that they need as well. And I'm sure for any of you who have read the news or been watching coverage, we all know that we have a crisis in our country and in our state, even though California fares better than other states with regards to pregnant individuals dying and or having really bad outcomes, most of which are preventable. And we also have deep racial and ethnic disparities in our state that we think we need to fix and eliminate. We can go to the next slide. So the report is linked here. It's 130 pages, so if you want some light reading, you can go access it. But it really provides much more detail on what are the statistics and facts and figures today regarding maternal health, what did we learn in this project, and what are we going to do about it. But we will be giving you an overview in the next few slides as we go through this. I also want to call out our funders, the Lucille Packard Foundation and California Healthcare Foundation, who funded this entire project and worked with DHCS. So I'm going to go through this in more details, but we essentially did a lot of listening and fact-finding from providers, from communities, from Medi-Cal members themselves to really understand what is not working today and what are the most pressing problems that we need to solve. We can go to the next slide. So one of the parts that I think was most excited about this project is this is one of the first initiatives at DHCS where we have really engaged members to identify the problems and inform the policy solutions in a comprehensive, deep dive way that we don't always get the opportunity to do at DHCS. So we engaged 30 unique members who are either pregnant or up to 2 years postpartum to really share their lived experience and what their journey was like while being pregnant or postpartum on Medi-Cal. We specifically chose members to represent the vast diversity in our program. Different experiences look different if you're in downtown Los Angeles or in rural Humboldt County. We picked different age groups, different languages, race, ethnicities to really try to understand what does this experience look like for different types of members. We did deep dive interviews with 6 of them, and we had 6 members who did journaling throughout their pregnancy because we know what could be happening to you when you are pregnant is different than when you have that newborn at home with you. And we also had a series of member voice work groups with about 20 members that met multiple times throughout this project. The other thing I will say is we chose 30 members because that is what we had grant funding to support, and we did compensate our members for participation. But when we got the word out that we were doing this project, we had over 400 applications. And I think that's just a testament to how eager our members are to share feedback with us and to help make Medi-Cal better and stronger. And lesson learned that the next time we do this, we will try to get much more funding to engage more members. We can go to the next slide. So I'm going to go into the next 2 slides in more detail than probably the rest of the presentation, because I think that this really grounds our work and becomes our true north. And the reason we did all of this member listening is at the end of the day, we want to solve the members' problems. There's a lot of other problems we've identified, providers have identified, but if we don't actually solve the things that we heard directly from our members, we will not count this project as successful. So there were 6 common themes we heard from all of those member listening sessions, and they're put in somewhat relative rank order. The most consistent thing we heard from our members is that they really want to feel respected and heard by healthcare providers. And this is really critical to their entire pregnancy journey. And I'm a healthcare provider myself. I recognize this sounds so basic, but it is clearly not happening consistently in our state and has tremendous impact on our members and how they go through their healthcare and the postpartum period. Members told us that they didn't always feel like their choices were respected, especially when it came to their birth plans and breastfeeding. We did hear positive feedback that for those members who had doulas, and you heard that a little bit in the video clip we saw, or who had midwifery-led care, that they did feel heard in their needs and preferences. We also heard from some members that they experienced discrimination in their healthcare encounters during all of the perinatal phases, not just prenatal or postpartum, but throughout the journey. Some of our members reported that when they could receive racially or culturally concordant care, they felt that that care was more respectful and really helped support them in their journey. And then we also heard from members that there's just a lot of balls that get dropped, that often the trust in the healthcare system is broken because they have screenings that are done and no one tells them what the screening results are, or that they are referred to services and no one ever calls them to schedule that service. There were times where people were screened for trauma and intimate partner violence with their abuser sitting in the chair next to them, and they did not feel safe or comfortable enough to give honest answers. We also heard that especially during transitions in care, once people deliver and are being discharged from the hospital, that it's not always clear what needs to happen next or how they get the follow-up. There's one mother who talked about her baby was diagnosed with jaundice and was kept in the NICU for a few extra days. And she was told, you have to be seen in 2 days to ensure the health of your baby. But then when she was discharged, she did not have a pediatrician appointment. She didn't know how to get one, and felt really stressed that she would fail her baby because none of that follow-up care had been coordinated. We can go to the next slide. These 3 findings we heard from our members, but I will also say we heard many of these themes consistently from our clinical and social drivers of health work groups that were comprised of providers and other agencies that work with pregnant and postpartum individuals like WIC, et cetera. But members often felt like even when services were available, they were fragmented and located in different places. So they had to go get their behavioral health care in one place, their medical follow-up in another place, their children's medical follow-up in a third place, lactation support somewhere else. And that often the burden was really on them to independently navigate and coordinate all this care. And especially in the postpartum period while taking care of a newborn, that often felt very overwhelming. We also heard consistently that finding behavioral health providers who could take care of people who were pregnant was really challenging. Often people waited a long time to get a behavioral health appointment, and then when they showed up, they were told that the provider did not feel comfortable treating someone who was pregnant or postpartum and prescribing medications. We also heard that consistently from members that they didn't realize all the benefits that are available to them. In some of the focus groups, a member talked about her doula experience, and most of the members in the group had no idea that Medi-Cal even covers doulas, or that they could have used that service or gotten transportation to their appointments, or that they were potentially eligible for services like WIC or CalFresh. We can go to the next slide. I'm going to go through our stakeholdering, but we'll pause there. And I see that there's a few questions in the chat. As we did our fact finding, we did use findings from other assessments that have been done across the state, including the maternal infant health assessment. And when you look at the report, you can see all of the background that was incorporated and informed this project. So as mentioned, we also interviewed a lot of people. I'm not going to, read every single name on this slide, but really wanted to understand again from the field and people who are working with pregnant and postpartum individuals every day on Medi-Cal, what is working and what is not working. Go to the next slide. We also launched 3 work groups who met repeatedly over about a 2-year period to both inform what are the problems we are trying to solve, but also help vet all of the policies that went into our ultimate report. So we had a clinical work group that was multidisciplinary and really focused on what is the clinical care, both behavioral health and physical health that pregnant and postpartum individuals need. We also had a dedicated social drivers of health group that really focused on all of the social needs of our members. Things like housing and transportation and food came up repeatedly in those work groups. And then we know that because Medi-Cal recently expanded coverage for postpartum care to individuals to 12 months, this is also a newer area where we don't have a lot of national guidelines or best practices. So we had a dedicated postpartum working group that really was trying to figure out what is all the care that is needed in that full 12-month period postpartum. I will also put in a plug that we are going to be publishing in the upcoming weeks or months a dedicated concept paper that really reflects the findings of this postpartum work group. So keep a lookout for that in our DHCS communications. We can go to the next slide. So as we talked to all of these people and had these groups, there was a number of common themes that people brought up. We know that we have challenges with access, especially for our members who live in rural areas. We know that there are real reimbursement challenges for midwives and lactation consultants and other maternity providers. We know that we have access issues with behavioral health care, as I mentioned. And we also heard consistently, we have so many programs in California that serve pregnant and postpartum individuals. And that part is great. The bad part is that none of them talk to each other or share data. And so it is often really hard for the OB provider to know what is happening in WIC or vice versa. Or we heard stories from our members where one member was at home with her newborn and she got 3 separate calls offering lactation services, one from her WIC provider, one from her OB's office, and then one from her managed care plan. And none of them were coordinating with each other, and the member felt really overwhelmed. We also heard that the group care models like centering pregnancy, can really help serve our members, provide community and relationships. And we heard this from our members as well. We can go to the next slide. We also heard a lot about CPSP. Many of you may know that the Comprehensive Perinatal Services Program has been jointly led by DHCS and the California Department of Health since the 1980s when it was founded, but it hasn't changed a lot since that time. So we heard a lot of feedback about what parts of CPSP need to be modernized and updated to really meet our members in the 21st century. We also heard that a lot of the bad outcomes for members come from not being at the right type of facility to really manage their risks. So members who have higher risk pregnancies need specialized care, and getting to that right level of care and provider can often be challenging. We are all aware of the housing crisis in our state, and this is affecting pregnant and postpartum members as well. And so housing has really come up as a major need. And then we also know that even though we have a lot of benefits that we cover in the Medi-Cal program, people aren't aware of them and aren't using them to the degree that they could. We can go to the next slide. So we talked to a lot of people. I think not even all of their logos are on this slide, but it just gives you a lens into, we really wanted this to be a comprehensive, broad-based effort that isn't just focused on medical care, but also really looking at all of those social drivers of health and other key state partners. We can go to the next slide. One more. So as mentioned, you can go read that 130-page report when you have time, but in the report, we proposed 42 policies that were really informed first and foremost by what our members told us was important, but also by all of the other stakeholders that I talked about. Of those, we have managed to finish 10, which is really exciting. 31 are in progress and one will be started soon. So I'm hoping in the next few months, everything will be either in progress or completed. We can go to the next slide. To give you a high-level overview, and there's much more detail in the report, all of the policies we are implementing fit into one of the following buckets. So we have a lot of work happening around provider access and managed care plan oversight. As mentioned, in current state, maternity care is one of the oldest parts of our program, but it also means that we have, I think, something like 20 or 30 all plan letters and parts of the contract that reference maternity care, and it is not clear and it is not all in one place. And so we're really working on modernizing and improving our policy so that it is much more clear what our package of maternity services looks like in Medi-Cal, as well as enhancing oversight and accountability to make sure that our managed care plans are providing all these services and our members have access to it. The next bucket is behavioral health. We know that there's workforce shortages and general access challenges, but how do we really make sure that we are increasing access and again, accountability and oversight so that pregnant individuals can get the mental health and substance use services they need during the pregnancy and postpartum period. As many of you know, as a part of our CalAIM population health work, we've been doing a lot around risk assessment, and we'll be doing a deep dive to really figure out how do we predict which of our members will be high risk in pregnancy and connect them to all of the services, medical, behavioral health, and social risk that they need to stay healthy and have a positive outcome. Also, as an extension of CalAIM, there's a lot that we heard around care management and social drivers of health. Many pregnant and postpartum individuals are eligible for ECM and community supports, but they are not aware. We did a site visit recently to a medically tailored meals provider, which is one of our community supports. Since the beginning of community supports, all high-risk pregnant individuals are actually eligible for medically tailored meals. Most of our maternity providers and pregnant members don't know that. And so we heard from that community supports provider that actually they are getting very few referrals for medically tailored meals, even though we know there's a lot of individuals who are eligible who are pregnant. And so really, how do we update our ECM and community supports policy guides? How do we make sure that they're really meeting the needs of our pregnant and postpartum individuals? We can go to the next slide. As many of you know, as a part of CalAIM, we have a huge justice involved initiative to help make sure that people who are in prisons or county jails get the services they need and then are linked to the right care post-release. There is a lot of details of how this works specifically for individuals who are pregnant or postpartum and are in custody. And so we've really made sure that the unique needs of that population are being addressed in our justice involved initiative. We also have heard loud and clear that payment reform needs to happen, and a lot of the challenges stem from either reimbursement rates or getting the right reimbursement for the right type of service. There's a lot of work happening on that. And then, as I mentioned earlier, I think some of the silos, as great as our programs are, if they don't talk to each other, if they're not sharing data, if we're not sort of supporting cross-enrollment across things like WIC and CalFresh and Medi-Cal, we are missing huge opportunities to leverage the services that we already have today. And similarly with state agency partnerships, hopefully you saw on that logo slide, we really are working with all of our state partners to reduce barriers and make sure we are comprehensively and cohesively serving this population. Go to the next slide. The report also has 6 areas where we make recommendations for future work. The reason these were not committed to is because they either require state law changes or significant funding or huge lifts that we are unable to take on with our resources today. But we didn't want to lose sight of this. These are things that our members and stakeholders thought were important. So they are there as sort of a future strategic roadmap for all of us to consider. We can go to the next slide. So now I want to move into the member communications, which I think is where we have so much opportunity and would love all of your partnership. And as I mentioned, one of the major factors we took away is that we have done so much work to transform Medi-Cal, to set up programs, and yet that awareness of those services and programs is not reaching our members. And so through the Birth and Care Pathway Project, we are working on a multimodal approach, and I'll ask when we get to Q&A if our OC colleagues want to add anything, to really think through how do we get this message to our members of the services that are there to help support them and their families through this journey. We developed some member fact sheets, which I'll preview in a second. We are overhauling our web pages to be much more member friendly, as well as leveraging social media campaigns and updating the My Medi-Cal mailer to really be much more focused on educating our members on this. Go to the next slide. So these are our member fact sheets, similar to the social media messages that you saw at the start of today's webinar. We have two fact sheets, one that really helps describe what the different types of providers are, so that members understand, what their scope is, what they can do for them, and really make informed choices about who they want on their care team. The second one is really a laundry list of services, both services that DHCS provides, like community supports, ECM, care coordination, as well as other programs from state partners like CalFresh and WIC and paid family leave. And we have translated these into all threshold languages. The QR code takes you to more information. We also tested these with our member groups. So we reconvened our member focus group. They reviewed these, they provided really helpful feedback on how to make these better. And then we also took them to our member advisory council that we have at DHCS. So just huge debt of gratitude to our members who helped really inform what type of information would be helpful. And I see that Isabel has dropped the links in the chat. So please help us get these out, help us share it so that we can really use them in our communications and help empower our members to take advantage of services that they have available to them. We can go to the next slide. Similarly, we also launched our maternal and perinatal healthcare services member webpage in September 2024. We are continuing to sort of tweak and modify these sort of in 2025, but we also welcome any and all feedback that you all have. What's good about this? What's missing that we need to modify so that we can make it as useful as possible? And again, I think some of the goal here is there are so many services scattered across different state departments, and it's hard to always know what all of those services are. And the more we can sort of cross-reference and make sure people are aware of everything independent of what department runs that program, the better it will be. We can go to the next slide. And then as mentioned at the top, we have social media campaigns that are coming, again, to really increase the awareness of what options are available to our members. And then we are publishing an updated My Medi-Cal in 2025. So this is a guide that goes to our members about all of their benefits, many of which are now delivered in managed care, but not all of which. So it really is the one-stop shop for all of the Medi-Cal benefits that people are entitled to, and looking at how we can update and improve the information specifically around perinatal benefits and providers. We can go to the next slide. So what comes next? As mentioned, right, this 42 policies takes a lot of time to implement. So this is not something that is going to happen overnight. It is a multi-year initiative. We will be continuing to update the Birth and Care Pathway webpage and issuing DHCS communications as we work through these policies. We'll also be using our normal stakeholder channels, the stakeholder advisory committee meetings, other meetings that we have to get public comment and feedback on these policies before they are finalized. And so please, if you're interested, keep a lookout on our Birth and Care Pathway webpage, as well as joining the DHCS stakeholder communications, because it will be a multi-year journey. And then we know that even once we issue the policy, right, that is not the end of it. Then we need all of our partners to come together, the providers, the CBOs, the local entities, public health, to really make sure that these changes are being implemented on the ground locally and reaching our members. And so we will be working through a lot of technical assistance and partnerships with you all and key state partners to figure out how we help support that local delivery system transformation. We can go to the next slide. This is our Birthing Care Pathway email address. If you have specific questions for our team that's working on this, please feel free to use that.